Welcome to the Deep Dive, where we cut through the noise and get straight to the insights you need. Today, we're plunging into a world that fascinates so many of us, the world of horses. These are magnificent animals, truly admired for their power, their beauty, their sheer grace. But if you've spent any time around them, you've probably seen something that makes you scratch your head, maybe even worry a bit. A horse endlessly pacing its stall in perfect circles or swaying back and forth at the stable door, almost like it's listening to music only it can hear. For a long time, these behaviors were often dismissed as, well, bad habits or vices. But what if I told you they're actually, maybe, a profound cry for help? Today, our deep dive is into equine locomotor stereotypic behaviors. We're going to unpack what these fascinating, sometimes perplexing behaviors truly are, why a horse might start doing them, what they look like, and most importantly, how we can genuinely understand and support horses who display them. Our mission isn't really to label or judge, it's more about uncovering a deeper truth about their well being and what they might be trying to tell us.
Exactly. And we're going to do that by drawing from a really comprehensive stack of expert analyses and practical management guides. We want to give you the clearest picture possible, arming you with knowledge to look at these behaviors not as faults, but as critical signals from the horse itself.
Okay, so let's jump right in. The very term stereotypic behavior sounds pretty scientific. What exactly are we talking about when we use that phrase with horses?
Well, at its core, a stereotypic behavior is a highly repetitive movement pattern that seems to have no obvious purpose. Think of it like a horse doing the same thing over and over, sort of like a broken record. What's absolutely critical to understand, though, is that these aren't just random quirks. The research is very clear. These behaviors often arise when a horse's natural, normal instincts, things they're biologically wired to do, like moving around or, constantly grazing, are blocked or thwarted somehow.
So it's like a natural drive gets stuck and then redirected.
Exactly. When that natural drive is blocked, these behaviors tend to emerge, often performed excessively and, completely out of context. And because they signal that something fundamental is missing from the horse's environment or routine, they are a significant welfare concern. It's a huge shift in perspective from that old idea of vices or stable vices. Scientifically, we now understand them as indicators of chronic stress, frustration, or maybe anxiety. In a way, they're actually a coping mechanism for the horse. It's believed they might even trigger the release of endorphins, offering the horse some kind of relief from whatever internal state they're experiencing.
That really reframes things, doesn't it? It moves from, ooh, that's a naughty horse, to this horse is actually struggling and trying to cope. So when we talk about these locomotive stereotypes, ones involving movement, what are the main types you're likely to see?
Probably the most recognizable one is weaving. This is that distinctive side-to-side swaying movement, usually involving the head, neck, and forequarters. But sometimes the whole body gets into it. It often looks like the horse is shifting its weight in the rhythm of a walk or trot, even when it's just standing still. You might also see them toss or nod their head, but just to be clear, this is separate from a medical condition called head shaking syndrome. That's different.
Okay. And what about the ones where they're actually, moving their feet?
Right, that would be stall walking, or sometimes people call it box walking. This is when a horse paces in circles when confined to a stall. They might go in one direction, or maybe both, but the pattern is incredibly consistent. They'll trace the exact same path repeatedly, sometimes even placing their feet in the very same spots each time. It's quite remarkable, actually. Then there's fence running, which is similar but happens outside a stall. The horse will walk, trot, or canter in a repetitive pattern along a fence line or maybe in front of a gate, covering the same distance and making the same turns over and over again.
It's fascinating how precise and almost ritualistic these movements can become. Now, while we're largely focusing on these movement-based behaviors today, it's worth noting that some of our research broadens the discussion a bit to include crib biting under the umbrella of equine stereotypies. Can you describe that one for us?
Sure. Crib biting, or sometimes called cribbing, is when a horse grasps a solid object like the top of a stall door or a fence rail with its front teeth, its incisors. Then it arches its neck, contracts its neck muscles, and actually swallows air, often producing an audible grunt or gulping sound as it does it. It's distinct from just chewing wood, which is generally thought to be about fiber intake or maybe boredom. Crib biting is considered a true stereotypic behavior.
Got it. So how common are these behaviors? Are we talking about something rare, or is it more widespread than people might think?
They're certainly not rare. Weaving, for instance, occurs in about 3% of horses, though, depending on the specific group or environment you're looking at, that number can range anywhere from 0 up to maybe 10%. Stall walking averages around 2%. with a similar kind of range. And these behaviors aren't confined to one region. You find them pretty much worldwide. Interestingly, studies don't show a specific age or sex that's more prone, but if a horse displays one of these locomotor stereotypes, it does seem to increase their risk of developing another one.
And certain breeds seem to pop up more often, right? I think I read warm bloods, thoroughbreds, standard breds.
That's right. Those breeds do tend to show a higher prevalence. We also see these behaviors more commonly in, say, endurance horses, and those kept in environments with pretty limited space specifically. The research points to less than about 1.5 hectares for exercise. This is particularly true if they're kept in those face-to-face stalls, where their natural instinct to move around or interact with other horses is often blocked or frustrated. And the onset age tends to be quite young, actually. The median age is around 64 weeks for weaving and about 60 weeks for box walking, so often starting fairly early in life.
So we've defined what these behaviors are and what they look like. Now let's get to the really crucial question. Why do they happen? What's actually at the root of it all?
The overarching understanding, and this is really a key insight from all the research we looked at, is that these behaviors are multifactorial, meaning there's rarely just one single cause. Instead, they primarily seem to stem from a fundamental mismatch between a horse's deep natural ethological needs, the way they're wired to live in the wild, and the way we often manage them in modern domestic settings.
That makes so much sense. It's like trying to fit a round peg in a square hole, environmentally speaking. What are some of the biggest environmental drivers of this mismatch?
Well, one of the top culprits, especially when we're talking about crib biting and maybe wood chewing too, is restricted foraging. Horses are natural grazers. They're literally designed to spend 12 to 18 hours a day slowly eating fibrous material. When they don't have sufficient continuous access to long-stemmed forage like hay or pasture, it creates a significant internal problem for them.
And what about their social lives? Horses are such herd animals. That must be huge, too.
Absolutely. Social isolation is another massive factor. Horses are highly social creatures, and a lack of adequate social interaction with other horses can be incredibly stressful for them, and they need that connection. Then there's just plain confinement. Prolonged stall confinement with limited turnout or freedom of movement just goes against their very nature as animals designed to roam and cover ground.
I can easily imagine how diet plays into this, too, beyond just the foraging aspect.
It definitely does. Diets high in concentrates, those sugary, starchy feeds, and low in actual forage can lead to serious gastrointestinal upset, things like gastric ulcers or hindgut acidosis. This physical discomfort then feeds directly into behavioral issues. And, broadly speaking, a lack of enrichment and chronic stress are major contributors. That means not enough mental stimulation, a monotonous environment, or really any form of ongoing stress. That could be inconsistent handling, intense training schedules, underlying pain that hasn't been addressed, or other health problems. It all adds up.
And even their exercise patterns can contribute. That's interesting.
Yes, even that. Management practices that inhibit their natural locomotion or lead to really inconsistent exercise patterns like, say, periods of intense work followed by enforced stall rest can also be a trigger. It's about disrupting their natural rhythms and maybe their expectations for movement.
Okay, so beyond those primary environmental factors, are there other pieces to this puzzle? What about genetics? Is it just something they're born with sometimes?
Genetics certainly seems to play a role. Like we said, certain breeds show higher prevalence, and there's some evidence that foals of crib-biting mares or stallions might be more prone. It does suggest a genetic predisposition. What's also interesting is that while it's not thought to be the primary cause, horses can apparently learn these behaviors from observing other horses, particularly when they're young. However, and this is really crucial, those underlying stress-inducing environmental factors must be present for the behavior to truly take root and persist. It's not just simple copycat behavior if the underlying conditions aren't also conducive to it.
Right. The environment has to be ripe for it, so to speak. And we can't forget about those gastrointestinal issues we touched on earlier, especially with cribbing.
Yes. There's a very strong association noted in the research, especially between gastric ulcers and crib biting. Now, the exact cause and effect can be a bit debated, like, does the cribbing contribute to the ulcers, or do the ulcers cause the cribbing, or maybe they're both just symptoms of deeper stress. But what we do know is that treating those ulcers effectively, often with medication, can frequently lead to a significant reduction in the severity of the crib biting behavior. So there's definitely a link there.
So if a horse does start displaying these behaviors, what are the actual consequences? We're not just talking about something that looks a bit odd, are we?
No, not at all. There could be real physical effects. For the locomotor behaviors like weaving or stall walking, you can see musculoskeletal problems. Things like uneven hoof wear, maybe asymmetrical muscle development from the constant repetitive movements, and just general stress on their joints, tendons, and ligaments. For crib biting, the teeth can suffer abnormal wear, particularly those front incisors they use to grasp objects. And from rubbing on stall doors or other surfaces while weaving or walking, skin lesions can appear. While it's considered rare, if the behavior is extreme enough to cause significant fatigue or maybe self-injury, it can even lead to decreased performance.
And then there's the broader impact on their overall well-being and just the practical issues for owners, too.
Exactly. These stereotypies can interfere with the horse's ability to express other normal behaviors, like resting properly or even performing learned responses sometimes. The constant energy expenditure from something like stall walking or weaving or maybe interference with eating because of cribbing can potentially lead to weight loss or it's just poor body condition if not managed well nutritionally. And yes, there's the very practical side of property damage, chewed fences, damaged stall doors, worn patches in the stall floor. That's a real concern for owners.
And the sad irony, as you mentioned, is that sometimes owners, out of maybe concern or frustration, might isolate an affected horse, thinking it's bad for others, which only deepens the horse's social isolation and potentially makes the root problem worse.
It's a truly unfortunate cycle sometimes. And specifically for crib biting, though it's considered rare, there's an increased risk noted for epilus, which is a type of gum growth,
Yeah.
and very, very rarely a serious condition called temporal-hyoid osteoarthropathy, which affects a joint near the ear and can cause nasty neurological issues.
Okay, this brings us to the most critical part then, effective management. How do we actually help these horses cope and ideally thrive? What's the best way to approach this?
Our sources are incredibly clear and consistent on this. The cornerstone is a holistic approach. That means we're not just trying to put a Band-Aid on the behavior itself. We absolutely have to address the underlying causes.
And I imagine the very first step before anything else is to rule out any physical issues like pain.
Absolutely. Always, always begin with a thorough veterinary examination. This means a good physical checkup, assessing their dental health, looking carefully for any lameness, however subtle, and especially checking for gastric ulcers, perhaps with a gastroscopy, or any other underlying medical conditions. Treating any hidden pain is paramount. It can dramatically reduce, or in some lucky cases, even eliminate the behavior entirely if pain was the primary driver.
Okay, so once we've confirmed there's no underlying pain or we're treating it, then it's really about making those crucial environmental changes. What are some of the most impactful adjustments we can make?
Environmental modification is, without a doubt, the single most important strategy. These changes are all designed to bring the horse's life more in line with their natural ethological needs and significantly reduce their stress levels. The first big one is to maximize forage intake. That means providing, ideally, unlimited access to good quality hay or pasture. Use things like slow-feed hay nets or feeders to extend their eating time, make it last longer, mimic natural grazing, offer a variety of forages if you can, and crucially, the advice is generally to increase the roughage in their diet while significantly reducing or even eliminating high-starch concentrates.
Right, so feeding them much more like they'd naturally eat in the wild. That makes sense. And then there's that social aspect we talked about.
Yes, increasing social contact is absolutely vital. Group housing is often the ideal scenario, allowing for natural herd interactions. But if they have to be stalled, ensure horses have visual and, if safe, tactile contact with other horses, maybe through bars or safe partitions. Even considering a compatible companion animal, like a friendly goat or a donkey, can provide crucial companionship for some horses. There's even some research suggesting an unbreakable, scratch-resistant mirror placed near the stall door can sometimes distract weaving horses, though that's probably not suitable for horses that are genuinely aggressive or fearful towards others.
Interesting. And just letting them be horses more, getting them out, letting them move.
Exactly that. Maximize turnout and freedom of movement. As much time as possible spent in pastures or large paddocks is best. You can even encourage movement within their space by strategically placing feed and water sources far apart, forcing them to walk between them. The goal really is a consistent high level of grazing opportunity, turnout time, and general aerobic activity. And for environmental enrichment inside the stall or paddock, offer horse-safe toys like treat balls or hanging toys they can interact with. Introduce variety into their daily routine and exercise regimen. Provide deep bedding, especially straw if possible, as it gives them something to investigate and forage through, which is a natural behavior, and it also decreases wear and tear on their feet and legs. Even just feeding forage in multiple piles on the floor can encourage a more natural browsing pattern.
So it's really about creating a more stimulating, more natural, less stressful environment overall. And finally, those dietary adjustments we touched on.
Yes, just to reiterate, reduce those non-structural carbohydrates, that's basically your starches and sugars, by minimizing or cutting out grain-based concentrates. Prioritize a forage-based diet. Only supplement with low NSC ration balancers or maybe fat sources if extra calories are genuinely needed for condition or workload, and ideally based on forage analysis.
Now, just as important as what to do is maybe what not to do. There are some common approaches that it turns out from the research are actually counterproductive and potentially even harmful, right?
Absolutely. The research strongly advises against devices and management methods that only focus on preventing the horse from performing the behavior without addressing the underlying psychological reasons. Frankly, the sources state pretty clearly that's not considered humane treatment.
And punishment, which might seem like an intuitive reaction for some people, is actually ineffective.
It really is. Directly punishing the behavior itself generally doesn't work long term. In fact, it often increases the horse's stress levels, which can potentially lead to new or even more intense problematic behaviors. Or the horse might just learn to perform the stereotypic behavior only when the punisher, the person, isn't around, so it doesn't solve the root issue.
So things like cribbing straps or anti-weaving bars, these are purely suppressive tools. They don't fix the why.
That's exactly right. These symptomatic controls only suppress the outward behavior. They do not address the underlying stress or motivation. Worse, they can cause physical discomfort or even injury to the horse. And they often lead to something called behavioral displacement. That's when the horse stops one stereotype because it physically can't do it, but then starts another one like stopping crib biting because of a strap, only to begin stall walking obsessively. So the advice is generally to use these with extreme caution, if at all, and only as a very temporary measure while you're aggressively implementing all those positive environmental and management changes. They're not a solution on their own.
That's a really important point. And what about surgery? I know for crib biting, there used to be a surgical option discussed more often.
Yeah, surgical procedures, like the modified Forcells technique for crib biting, are actually rarely performed nowadays. Their success rate is quite variable, and again, critically, they only address the symptom, the physical act, not the underlying cause, the horse's internal state.
Lastly, where does medical management fit into all this? Are there medications that can actually help?
Medical management is rarely seen as a primary solution on its own, but it can definitely be a valuable adjunct in certain situations. If gastric ulcers are diagnosed, for example, aggressive treatment with appropriate medications like omeprazole or maybe ranitidine can lead to a significant reduction in crib biting for many horses. That's well documented. As for using psychoactive medication, drugs specifically for behavior, that's still considered largely experimental in horses and rarely justified in standard practice. Generally, the potential risks, the welfare implications, the cost, and just the feasibility of long-term use don't support it as a standalone solution for most cases. Now, in extremely severe, intractable cases where welfare is seriously compromised and nothing else has worked, a veterinarian who specializes in behavior might consider very cautious, short-term use of certain psychotropic medications. Perhaps something like acepromazine for profound anxiety, or maybe fluoxetine for very OCD-like behaviors. But this is really rare, and it's always done in combination with comprehensive environmental and management changes. It's also crucial for owners to understand these are often experimental and off-label uses in horses, requiring fully informed consent and very careful veterinary monitoring. It's not a first-line approach.
Okay, so after implementing all these management strategies, ruling out pain, what's the realistic outlook for a horse displaying these behaviors? What kind of prognosis can we actually expect?
Yeah, it's really important to set realistic expectations here. The prognosis for entirely eliminating an established locomotor stereotypic behavior, once it's really ingrained, is generally considered guarded to poor. These behaviors are often deeply rooted, likely involving actual neurobiological changes in the horse's brain over time, especially if they've been doing it for years. They become almost like a habit at a neurological level.
That makes sense, given they often start as coping mechanisms. But that's not the whole story, is it? There's hope for improvement.
Not at all the whole story. The really good news, and this is truly empowering for owners, is that the prognosis for reducing the frequency and severity of the behavior and dramatically improving the horse's overall well-being and quality of life is generally good to excellent. That is, provided there's comprehensive, consistent, and long-term management focusing on those underlying needs. Success is definitely influenced by things like how long and how severe the stereotypy has been, how consistently owners can implement and stick to the management plan, whether any underlying pain is effectively treated. And maybe even the horse's age of onset, sometimes behaviors that start later in life seem slightly more amenable to change than those established very young. And that potential genetic predisposition might play a role in how persistent it is, too.
So, what are the key takeaways for our listeners, especially if they're horse owners currently dealing with this kind of situation?
I think first, persistence is key. Recognize that many horses, especially those who've been dedicated cribbers or weavers for a long time, may continue the behavior at some level, particularly during stressful periods or if their environmental management slips a bit. Don't get discouraged by that. But the most important point is that improved welfare is absolutely paramount. Even if the behavior doesn't completely disappear, addressing the underlying needs through better management profoundly improves the horse's quality of life and significantly reduces their internal stress. That's the real win.
And importantly, for those who worry about their horse's performance potential, if these behaviors are managed effectively to prevent significant physical consequences like weight loss or injury, most stereotypes don't actually directly impact a horse's athletic ability.
Exactly. And finally, a key insight for owners is to try and avoid inadvertently reinforcing undesirable behaviors with your reactions. Giving attention, even negative attention, can sometimes reinforce it. And critically, despite some old lingering beliefs, the scientific evidence really does not support the idea that these behaviors inherently cause a horse to be unthrifty or lose condition, as long as their nutritional needs are being properly met otherwise.
This deep dive truly brings home the idea that these behaviors aren't just quirks or unfortunate vices. They are powerful, sometimes really desperate, indicators that a horse's fundamental psychological and physical needs aren't being adequately met in their current situation. It's actually a profound testament to their adaptability and sensitivity, isn't it? Finding ways, however maladaptive they seem to us, to cope in environments that don't always honor their true nature.
Absolutely. And that's where the empowerment really lies for us as caregivers, understanding these underlying causes and then diligently implementing holistic, ethologically sound management practices can dramatically transform a horse's welfare.
Right.
Even if the specific behaviors don't vanish entirely, you are consciously providing a life that respects and honors their natural instincts much more closely. And that's huge.
So, as we wrap up, what does this deep dive into equine stereotypes tell you about the really intricate connection between any animal's natural needs and its environment? Could understanding these behaviors in horses maybe give us a new lens through which to view the well-being of other species and perhaps even ourselves when our own fundamental needs for things like social connection, mental stimulation, and freedom are thwarted? Something to think about.